I'd like you to have a personal experience here and now that I hope will validate this method, give it some credibility for you. I want to guide you to do the same thing that I guide every one of my patients in teaching them this method. This is part of the setting the stage for the work to begin. In my practice, generally, the first session is devoted to history taking, perhaps various tests, logistical matters, and during that first session, I typically offer all of my patients the skill of self-hypnosis if they are interested. May I have a show of hands, those of you who have had some training in hypnotic methods? May I, please? Oh my. The rest of you need to go back to school. Hypnosis has a lot of bad press. It is very unearned, inaccurate. Hypnosis is a natural part of life. We all experience this phenomena thousands upon thousands of times in life, spontaneously. It's an incredibly valuable clinical tool. Well, about 98 or maybe 97% of the patients I offer to train in self-hypnosis take me up on it. We will do some of this in the course at the end of this conference. Now, but getting back to the communication. See, I am submitting that each of you has a centrum, has this higher level of intelligence. I'd like to introduce you to your own centrum here and now, if you're open to it. I can't do it for you. Kind of a unusual, not kind of, it's a very unusual thing to do, but very innocent. I'm going to ask that you create in your mind's eye, using your imagination, create an image of what I'll call a chalkboard. It could be a chalkboard. It could be a piece of paper. It could be a computer screen. I don't care what you imagine, just some platform on which your centrum can write. Then while you are imagining your chalkboard, which is what I'm going to call it, no matter what you create, while you are imagining your chalkboard, I will ask Centrum to respond by writing a word. Well, if you have cooperated thus far, very likely that word will appear. And you will, at that point in time, intellectually be questioning, well, yeah, it says yes, but how do I know that came from Centrum? I can imagine anything I want. A perfectly legitimate question. But there's something different about this. The point is that if Centrum writes, in all probability, you will not be able to erase it. And so I will invite you to try to erase it. And then I will guide you to take this another step. I will ask Centrum to erase it and replace it with a different word. I will ask Centrum to select the word to be written. And I will ask Centrum to select a word you will not consciously expect, a surprise word. Now, is everybody guaranteed to have this? No. But I think everybody is guaranteed to have this who is open to this experience. My patients in that clinical setting sometimes have difficulty imagining a chalkboard. Some of us have difficulty imagining, in which case we use a different method. Well, I won't have time to go into the other methods here today, but I would like those of you who are open to this to have this experience. So let me ask each of you now, create an image of this piece of paper, chalkboard, whatever you decide to imagine. Just create the image. You may want to close your eyes, you may want to keep your eyes open, I don't care. Just get in that image in your mind's eye. And now I ask your Centrum to indicate willingness to communicate in this way by writing the word yes. Y-E-S, yes, they're on that chalkboard. Centrum, please write that word yes now. Well, now, if we're on an individual basis, I would just ask you to let me know when the word is there. In this situation, as a group, I'm going to assume, hope that it's there for you, and invite you consciously to try to erase that word. And now I ask your Centrum to replace that word with a surprise word, a word you will not expect, a word that you will consciously know you did not consciously think that one up and put it there. That kind of word, please, Centrum. Please do that now. May I have a show of hands when that word appears for you? Now I realize this is an odd setting to do such a demonstration. That's all right. In the clinical setting, the odds are very high of success. And I encourage each of you who did not get the surprise word, play with this yourself privately. You don't need to tell anybody what you're doing. Well, let's assume you are my patient and your Centrum wrote this surprise word, and now you are consciously aware that something different is going on. I didn't suggest the word, the patient didn't suggest the word, and there it is anyway. So the stage is set for real therapy to begin. The next step is that of of having the patient define the goal or goals, there can be many, to be accomplished using the method. Simple statements of desire. I want to eliminate the headaches. I want to eliminate the psoriasis. I want to get rid of these hallucinations, or whatever the goal is. A simple statement. And then the clinician guides Centrum to find out when, where, why, how that began, identify that part of the mind that was created when it began, and recondition that part. That part is stuck, stuck back there in time. That part knows only what the patient knew when that part was created. And that could be very young indeed. So, reconditioning, you see, happens by education. Well, patients can't do this kind of thing consciously. Patients don't know why they have the problems they bring to you. They may have rationalized, they may give you elaborate explanations. And using this method, they're consistently surprised then to find out what the real cause was. When the cause is resolved, the symptom ceases to exist, whether it's a behavior, any psychogenic, that's a big word in my world, psychogenic, psychologically inspired at the beginning. A psychogenic disorder is any disorder that is the consequence of some earlier experience. Or whether the consequence is mental or physical, this method is going to be highly effective in addressing it. So now I want to open the floor for questions. And I see my man back there with the microphone is on the ball. He will want you to express your question so others can hear it. Anybody have a question? Here comes one.
Thank you for this interesting presentation. Why do we have to go for these new concepts? Is it enough to integrate these new concepts of you into the old concepts of conscious and unconscious? Why go to extra conscious? Why go to super intelligence? Why don't we say about the super intelligence that it's part of the homeostasis of the body in general, as if there is homeostasis in psychiatry, which is similar to other branches of medicine. So, by the way, I lived the experience with you. I created differences with you in my mind. Then I created integration as these stages which you try to guide us through. Like I created the thesis and antithesis, and I tried to integrate the thesis with the antithesis, which is, it proves that you do have a good point here. Thank you so much.
To answer the first part, why do we have to have a new model? New models. You know, Freud was a genius. There's no question about that. But all acquirement of knowledge and understanding did not end with his life. There has to be room for new understanding. Well, the model Freud designed, 3 parts. But the definition doesn't fit. The definition of these parts is not adequate to explain the phenomena of this method. When you back off and consider this method, what's it doing? How do you compare that to the work of Freud? Well, there's certainly a lot in common. Freud did not at any point, as far as I know, attribute any higher level of intelligence to the human mind. And yet it's there. This is simply a method of tapping into that. I wish I had time to do a demonstration, but I don't. The method is also not just effective, it's extraordinarily efficient time-wise. It's the briefest of brief therapy. If you go to the website of the Institute, what happened to my... May I have my last slide, please? Go to that website. There's a wealth of information there. Videos of demonstrations, narrations of various kinds. It's an excellent website, if I did create it. I have documented this method with a formal textbook published by Crown House. It's an established method. In spite of being so new, in some countries this is really taking over, in Germany in particular. If you go to this website and search by country, you can identify the therapists that I have trained in those countries. To date, 16 countries that I have taught, in which I have taught this method. Oh yes, we have a question.
Hello, thank you.
Hi.
Hi, I have a question. In my practice, I like to conceptualize a lot using concepts from internal working models and schemas and such. Mm-hmm. And I guess what struck me is that you seem to be suggesting that this superconscious is highly intelligent and evolved, and kind of in my conceptualization, often it's maladaptive in some way. And so when you're bringing it up into consciousness, you're trying to somehow modify it or correct it, and kind of I'm struck by what you're saying, which seems to be suggesting that somehow it has your best interest in mind, which hasn't been my experience. Okay. I wonder if you could comment on that.
I just demonstrated the inadequacy of my ability to explain this method. Centrum has all of these positive elements. The subconscious domain, this middle domain, that's like the memory of a computer. That's where the dysfunction is. The person learns something dysfunctional in that part of the mind. The subconscious domain seems to consist of the collection of all of the influences from earlier experiences. Most of them good. But once in a while, we learn a dysfunction. We learn that pain gets attention. That's the biggest, by far, prompter of chronic pain. It gets attention. Absurd? Well, not really. Kind of logical. The point is that it made sense at that point in time when it was initiated, when it was created. It made sense for the little kid to learn to be afraid of dogs. It makes sense for the traumatized person a rape situation or whatever, to learn something dysfunctional from the experience. Well, that learned element is, like I say, it's stuck. And you have to be able to identify it. And the patient doesn't know what it is. I've never met a patient who knew why they had the problem that presented. Okay, guys, one more question, if you have one, and I'm going to relinquish this microphone. No more questions. Okay. Nice to know that I satisfied all of those questions in this brief period. I want to introduce my co-speaker here. Thank you. Dr. Atin Shah is a psychiatrist. He has various impressive titles that go with his work. He's from Houston, Texas, another American. He is primarily interested, it appears, in the area of lactation, pregnancy, and the psychotropic effects on those issues. Being a psychiatrist, he is, of course, interested in psychotropic medication. The title is, Are Psychotropics Safe in Pregnancy and Lactation? Dr. Shaw.